Hello. Many English words can be understood in Japan as they are. Today, we will introduce useful English words for situations where you get sick while traveling in Japan and need to go to a hospital. Don't worry, Japan has highly advanced medical technology, so you can visit with confidence. However, just in case, let's learn some important phrases beforehand. Here are some English words that can be understood in Japan when visiting a hospital. Emergency, hospital, clinic, doctor, nurse, check, test, scan, tablet, virus, bacteria, stress, mask, gauze, band-aid, pain, sleep, cold, no energy, nervous, shock, relax. Next, I will introduce some phrases that the emergency team, doctors, and nurses might say to you in this situation. Do saramashita ka? Kyūkyū shao yobimasu ka? Namaado seinen gappio oshiete kudasai. Doko ga itai desu ka? Itsu kara itami ga arimasu ka? Nani ka arerugi wa arimasu ka? Netsu o hakarimasu ne. Ketsuatsu o hakarimasu. Iki o sutte, haite kudasai. Onaka o misete kudasai. Nani ka kusuri o nondeimasu ka? Rentogen o torimasu. Kaze desu ne. Influenza desu. Shokuchu udoku no kanousei ga arimasu. Kosetsu shiteimasu. Tenteki o shimasu. Kusuri o dashimasu. Kono kusuri wa, ichinichi, sankai nonde kudasai. Ansei ni shite kudasai. Shujutsu ga hitsuyou desu. Now, I will introduce some example conversations where you can handle the situation using only English words.
Do saramashita ka?
Heddo, itai, emergencies.
Arukemasu ka?
No u, herupupuriisu.
Wakarimashita. Byou ne ikimashou. Onamaedo se ningappio oshiete kudasai. Doko ga itai desu ka? Itsu kara itai desu ka?
Today mo ningu.
Netsu o hakarimasu ne. Sanju kudo desu ne. Daijoubu desu yo, okusuri o dashimasu.
Okay, sankyu.
Kono kusuri wa, ichinichi sankai, nonde kudasai.
Okay, mo ningu, ranchi, naito.
Hai, sono tori desu. Tada, nemukunaru koto ga arimasu.
Lastly, I would like to introduce some other Japanese words that you should remember in this situation. Tasukete kudasai. Kyūkyū shao yonde kudasai. Byōui ni ikitai desu. Eigo wa hanasemasu ka? Tsuyaku o onegai shimasu. Netsu ga arimasu. Atama ga itai desu. Onaka ga itai desu. Kibun ga warui desu. Hakisou desu. Memai ga shimasu. Seki ga demasu. Iki ga kurushii desu. Arerugi ga arimasu. Kusuri o nondeimasu. Itai desu. Konokusuri wa itsu nomimasu ka? Konokusuri no fukusayo wa arimasu ka? Nyuin ga hitsuyou desu ka? Yakkyoku wa doko desu ka? Mou ichido itte kudasai. Yukkuri hanashite kudasai. Kamini kaite kudasai. Nihongo ga wakarimasen. In addition, Japanese has few accents, so it seems easier to understand if the intonation is constant. Please be careful when pronouncing it. Many people can understand simple English, so it's a good idea to speak slowly. If your health suddenly worsens in Japan, and you need to call an ambulance, dial the emergency number, 119. In Japan, 119 connects to the fire department, which handles both fires and emergencies. When you call, you will first be asked, is it a fire or an emergency? You should answer, emergency, QQ Dezu. After that, you will be asked for your location. So try to provide it as accurately as possible. If you are at a hotel, give the hotel's name. If you are at a station, give the station's name or provide nearby landmarks to make it easier. You will also be asked about your symptoms. So try to explain with simple English or Japanese, such as unconscious, difficulty breathing, chest pain, or high fever. Ambulance services are free, but treatment at the hospital may incur costs. Once you arrive at the hospital, you will be asked for your name, birth date, and symptoms at the reception. In Japan, it is common to fill out a medical questionnaire before seeing a doctor. If you don't understand Japanese, you can ask, do you have an English medical questionnaire? Eigo no manshinyo wa arimasu ka? Afterward, you will see the doctor, and tests like blood work, X-rays, or CT scans may be performed if needed. Once the examination is complete, the doctor will explain the prescription. In Japan, sometimes medications are given at the hospital, while other times, you will receive a prescription to be filled at a pharmacy. If you are given a prescription, take it to a nearby pharmacy. Look for a store labeled Chouzai or Chouzai and submit it there. Many pharmacies can understand basic English, but if you're unsure, you can ask, how do I take this medicine? Kono kusori wa do yata no mamasu ka? For Japanese citizens, health insurance covers about 30% of medical expenses. But travelers are not covered by this system and must pay the full amount. For example, a simple consultation for a cold and medication might cost between 5,000 and 10,000 yen. And if tests or treatments are required, the costs may be higher. Therefore, it is recommended to purchase travel insurance before your trip. If your credit card includes insurance, you may be able to use it. So it's a good idea to bring your insurance card or proof and show it at the hospital. Some hospitals may only accept cash for payment, so it's important to carry enough cash with you. In Japan, when you check out or receive treatment, you may hear the phrase, odaiji ni shite kudasai, odaiji ni shite kudasai, which means, take care. This is a common expression in Japan, so it's a good idea to smile and respond with, thank you, arigato. Thank you for watching the video so far. If you found this video helpful, please give it a thumbs up and subscribe to the channel. Also, feel free to leave a comment with any other English phrases you'd like to learn about using in Japan. See you in the next video. Bye bye.